Hi everyone, my name is Liz Rektoric and I'm doing my quality improvement project on increasing antiplatelet compliance post-PCI to prevent stent restenosis. I'm working with the pharmacist that's on my floor to get this together. We are working to get every patient discharged on Brilinta or Effient, a free 30-day supply at discharge, because what we are seeing is a lot of the pharmacies don't carry Brilinta and Effient, and then the patient is being discharged to home and they have no way of getting their antiplatelet medication. In addition to that, we are also giving them these booklets. We have a support book for Effient and also a support book for Brilinta. And these support books are great because they give the patient the support service phone number if they're having problem trying to get their medication. That way, when the patient goes home, they have the 30-day supply so they can then figure out where they're going to be getting their antiplatelet from for the rest of their therapy. This is just a way to decrease stent restenosis and death, because we've actually seen in the past year, since Brilinta and Effient are being prescribed more, well, also that they're harder to find, but we have also seen 4 people that have died that have not taken their antiplatelet. So this is a way to get them their medication so they take it, and then we're going to be following up with them to make sure that they have a pharmacy in mind to get that medication from after the 30-day script is gone. Problem identification has brought about this quality improvement project. In the last year, Brilinta and Effient are newer, more potent antiplatelet medications. They're being prescribed more and more by doctors and practitioners. Problem is, these medications are not always carried at patients' pharmacies, so patients have been discharged without access to this very important medication. In the last year, Don Larson, who is the pharmacist on my floor, stated that there have been 4 patients who have died from stent restenosis due to the inability to obtain their antiplatelet medication. Many patients have stated difficulty obtaining their medication on follow-up phone calls, which made them miss a few days of their antiplatelet therapy. This is what has caused the quality improvement measures to be taken to give the patients a free 30-day supply at discharge. Adherence to these guidelines improves outcomes. Monteslap, Brieger, Dalby, Park, and Mahan, 2015, stated cessation of dual antiplatelet therapy is associated with the unacceptably high risk of thrombotic events or even death. The aim of my QI framework is to decrease the patient's risk of stent restenosis by 100% within the next 2 months by providing a 30-day supply of their prescribed antiplatelet at discharge. This will be in place by the end of October 2016. To establish measures, we're going to evaluate medication compliance by making follow-up phone calls post-discharge to ensure patients are taking their 30-day supply, and also ensure they have identified a pharmacy in their area which carries their medication for seamless transition. We've identified our changes as giving patients their 30-day supply of their antiplatelet at discharge, ensure follow-up calls are being made by pharmacy technicians, and confirming that the patient has identified a pharmacy which carries the medication within 30 days. To measure outcomes, we're going to measure the effectiveness of this system change by quantifying the amount of readmissions due to stent restenosis and evaluate the reasoning behind it to evaluate effectiveness of the medication program. We're also going to measure early stent thrombosis and mortality in patients at the end of December. Planning for this quality improvement project, we enlisted help from our pharmacist Don Larson, who sent this letter out to all the practitioners and doctors. Also, there will be a designated bin on my floor, which is 7 West, and one in MIU, which is the Mercy Interventional Unit. Providers will order all the antiplatelets on post-PCI patients and also be sure to give those patients a 30-day supply. Nurses will ensure that the patients have their medication at discharge.